All right, there we go. Thanks again for joining. My name is Laura Santner, and I've been doing these question and answer sessions for a while now. So welcome. It's been really fun. I'm glad I can answer your questions to the best of my ability. Um, I'm a clinical social worker, also actually a registered poetry therapist, kind of like a fun little fact. And I've been working here with Skin Pick for a while now. So I'm happy to be here, and I've been working with BFRBs, body focused repetitive behaviors, for a long time. So I'll do what I can to answer your questions. Type your questions in the question and answer box. Some people pre-submitted questions, so I'll be going over those first. And then I'll be going over the live ones next. Okay. Yeah, so just relax. It's gonna be pretty casual. Have some water with you, have a fidget. I got a little fun fidget here. This is, if you guys remember, like the slap bracelets. This is like a silicone slap bracelet. I really like this one because it has like the little spikes, but also it kind of like pops a little bit. So it's kind of fun to play with. So I got my fidget. I hope you have yours. And I will be going over the pre-submitted questions first. Okay, let me see. Okay, so this question comes in a lot. What causes skin picking? And what is the best kind of therapist to see? So the cause is not entirely known, and it's quite complex. As of now, research indicates that there's a large genetic predisposition. However, just because there is a genetic predisposition does not mean that you're going to have a skin picking disorder. There are additional factors, and it's a combination of factors. So, for example, your hormones, temperament, the age of onset, any potential co-occurring disorders, environmental stress factors. So it's a combination of things, and it's kind of like that magic combination. So if you have one risk factor, I guess I would say, it doesn't mean you're gonna have the disorder. It's a combination of risk factors. So I hope that makes sense. And by the way, if anything doesn't make sense, just write in the question and answer box, and I'll clarify. Oh, and the second part to this question, the best kind of therapist to see. So the best kind of therapist to see would be one that's trained specifically in BFRBs, body focused repetitive behaviors. That is what skin picking disorder is. So you can find trained therapists on skinpick.com, on bfrb.org, through the program skinpick.com. If you join the program, all of those therapists are highly trained and knowledgeable. So I would recommend that. If you're going out on your own looking for someone, I suggest looking for kind of some keywords. So you want them to be trained in the comprehensive behavioral model, acceptance and commitment therapy, habit reversal or habit reversal training, cognitive behavioral therapy, dialectical behavioral therapy. And of course, you want to connect with your therapist if you're looking. And when you're working with your therapist, they should be working with you. You are not just your disorder. You are you. You are a whole being. So it should be everything. Working on everything at the same time. Okay. Is dermatillomania a lifelong struggle, or is it possible to reach a point where the urge to pick does not resurface? Yeah, it's a good question. So dermatillomania, also known as skin picking disorder, it is a chronic disorder. So that means that there's no cure, and it is lifelong. But don't worry, But there's a big but. That said, it doesn't mean that it's going to be active the whole time, your entire life. So it is very possible for it to be kind of deactivated and go dormant, and no longer interfere with your life. So yes, you can reach a point where the urges do not resurface. Um, Something to also think about is as you are working on managing this disorder, you're building your memory muscle, your muscle memory of uh, of resisting, and practicing using your strategies. So you're going to have a lot of tools under your tool belt. So if the urge does resurface, it does not mean that you're going to pick. Um, it just might mean you have to work on your strategies a little bit harder. Okay. Hope that answered that. Okay. What sort of treatments are available to remove the evidence of my picking? Would love to get rid of the damage I have caused, if that's even possible. So scars left from picking can vary, right? So they can be really minor and go away in a couple days, couple weeks. Then they can be a little bit more serious, that might take longer. So like 6 to 18 months, I would say, is a longer period of time. If there are any kind of infections, any skin tissue damage, um, any complications that might have happened, that might prolong the recovery of your skin. Skin is quite resilient, so give it time. If you're not actively picking, have patience and see what happens. If you continue to be unsatisfied and self-conscious about it, and it's really bothering you, talk to a dermatologist and see what they can do for you. Some treatment options, they can range. So there are different kinds of creams and ointments, silicone pads. That's maybe a lower level form of treatment. And then a higher level would be something like laser or skin grafting. But talk to your dermatologist and see what works best for you. What role does nutrition play in urges? So, Dr. Grant is one of the leading researchers for BFRBs. So he actually did a study on sugar and on saturated fats. So he and his study showed that sugar does play a significant role, especially in being compulsivity. And he found that with fat intake, there actually was no significance. But interestingly enough, the combination of high fats and high sugar did significantly affect motor impulsivity. So something to think about and take into consideration. More research is, of course, needed. But as of now, mind your sugars. Something to pay attention to. Does caffeine cause an increase in urges? So so Dr. Grant, he did a study on this as well. So what he found is high levels of caffeine do increase urges, but moderate levels of caffeine, so about 1 to 3 cups, actually showed to help decrease urges. So that's kind of surprising. So it was associated with lower BFRB's symptoms. So what this suggests is that caffeine consumption, right, in moderation, 1 to 3 cups, may offer protective factors and benefits to individuals with BFRBs. So it can help increase alertness, and without bringing any negative effects. So high caffeine would bring negative effects. So over 3 cups might cause like anxiety, irritability, restlessness, more picking. But moderate amounts of caffeine might help you to be more aware and be able to better manage the urges when they do arise. So something else to be mindful about. It's pretty interesting. And again, as usual, more research is needed, right? We always need more research. I see questions are coming in the question and answer chat. Thank you. Keep them coming. I will look at those as soon as I finish the pre-submitted questions. Looks like we got a couple more of the pre-submitted questions first. Okay, how are we doing? I heard that NAC can be used to help with skin picking. What is the dose and is there a recommended brand? So if you're considering NAC or N-acetylcysteine, make sure you do consult with your doctor, medical doctor or psychiatrist. So NAC, N-acetylcysteine, is an amino acid supplement. So it's not really a medication. It's it's a supplement that so far is showing to be the most promising. When they researched NAC, they used the brand Swanson. So I'm not saying that's the recommended brand. There is no recommended brand, but the one that was the company that was the most cooperative for research purposes was Swanson. Other brands are fine. I don't really know much what's reputable, what's not. I know the research used Swanson. I'm a little bit familiar with the brand Now. I've had no issues with Now, but there are a lot of brands out there. If you try a brand and don't like it, try a different brand. Because it is possible that different brands might feel differently for you. The dose. So the dosing can vary. Right now, research is recommending starting with 1,200 milligrams. Excuse me, but spread out. So like 600 milligrams in the morning and 600 milligrams in the evening. Generally, it stays in your system for about 8 to 10 hours, which is why it's recommended to spread it out. Research has studied up to 2,400 milligrams. So there's a lot of flexibility, and so got to kind of see what works for you. And if you want to go higher than 24 milligrams, I'm sure that's okay. But again, talk to your doctor before doing any of this or playing with any of the milligrams. Was that question? Yeah. I think it's interesting that it lasts in your system about 8 to 10 hours. Some people have felt it only in their system having an effect for 3 to 5 hours. So taking it spread out can be helpful, especially during kind of your higher urge time. So you don't have to take it morning, evening. You can take it whenever you typically have higher urges. Okay. This is a longer question. There's a little background and then the question. So the background is a wife is seeking advice on how to support their 60-year-old husband who has been struggling with dermatillomania for about 20 years. He frequently picks at his skin, causing scarring and lesions, especially on face and neck, and uses tweezers to dig at perceived hairs. This behavior, likely worsened by stress, has strained his relationships and caused significant distress. Yeah. He has tried various treatments, including medication and therapy, but has shown resistance to evidence-based techniques for changing his behavior. While he has made some progress with a psychiatrist on escitalopram, he struggles with shame and frustration and is often irritable and angry, which affects both him and his wife. She has tried to be supportive and compassionate towards him and has done a lot of research on the topic herself, but she is feeling very hopeless. So the question is, do you have suggestions for families who are very concerned about the well-being of an individual who is resistant to accepting the diagnosis and non-pharmacological interventions? That's a very heavy question with a lot of background information. So I'm sorry. So thank you for sharing all of that information, and sorry to hear about all of these struggles. This can happen. You're not alone. My first thought is a question, and that is, what were the past treatments? So what were the past treatments, and were they, if the husband was working with a therapist, were they trained? Were they trained in BFRBs? As I mentioned in the very beginning, that is really important. So when you're working with someone, they have to have knowledge of BFRBs. The other thing that comes to my mind is, does the husband want treatment and agree that skin picking is interfering and causing distress? If he doesn't want treatment and doesn't see it as a problem, there's not a lot that can be done. He does have to be ready. So that said, he might actually already be working on it, and the family and people around him just might not realize it. So it is possible he's working on it. It's really hard to measure progress. It's hard to see it. You cannot measure it by the amounts of scarring and lesions, because if you have one slip, right, then you're going to have lots of scars. So it is very possible that he is working on it, and you're just not aware. So that's something to keep in mind as well. Sometimes taking a step back actually can be really helpful as a family member. So if you're overwhelming him, kind of getting on his back a lot, that could increase his urges and make him more stressed out. So give him some space. Give him some space to kind of work it out on his own. See where that takes him. I'm just reviewing, I keep reviewing the question, making sure I'm getting aspects of it. So medication, so he's on escitalopram. So there's no medication for BFRB. So if he's anxious, for example, then escitalopram will help with the anxiety, which might indirectly then help with urges, but it's not directly going to affect urges, right? Because there is no medication for BFRBs. As I mentioned before, NAC is an amino acid supplement, which is shown to have benefits. There's new research being done on memantine. So it's another potential medication that he could try. But I would applaud you and acknowledge all of the research that you're doing. And hopefully the husband is able to listen to some of that research and that knowledge. Hopefully you're able to share some of that with him and he's able to absorb it. You can point him in the direction of resources like skinpick.com. They're also, he's welcome to sign up for the program, but if that's too much and he's not interested in that, we have all of these free webinars, so much information, and we have blogs that are coming up quite frequently, so much information. So all of that can really be helpful. So he can work on it by gaining more knowledge, gaining more information, before kind of working on strategies and skills. So that's a good kind of first step, I would say. Keep being supportive. Keep having that compassion. Um, you're doing great. You're doing better than you think. This is hard. Be mindful not to tell him to stop. Don't point it out. You're doing it again, right? That's not going to be helpful for him. It's going to be overwhelming, and cause more frustration and more guilt and more anger and more picking. So instead, um, ask him what you can do to help. What does he need? Um, you can offer strategies. Um, See if you can get him anything like a fidget, for example. You can also hide those tweezers. You mentioned tweezers. You can hide them or freeze them, but asking permission first. Don't just do it. Make sure he's on board with that strategy. Try to distract him. Um, do things together, right? When you're doing things together, engaging in values, things that are important, things that are joyful, his urges are naturally going to decrease. That's also going to help with his motivation, right? When he's having more fun, doing more things with the family, um, he's going to feel better about himself. So that's going to make a difference as well. So hang in there, keep that love and the support. If you're really struggling, or continue to struggle, there are also support groups. He can join a support group, of course, but there are also support groups for caregivers and loved ones out there. So that's something that you could look into. Okay. I hope that answered that question. Um, I'm gonna go into the ones that you're writing right now. Those were the pre-submitted questions. Oh, I'm just kind of skimming them a little bit. Oh, okay, some good ones. So what type of mental illness is dermatillomania? What type of mental illness? So dermatillomania is part of body focused repetitive behavior. So right now in the DSM, it's categorized as it's kind of related cousins to OCD and related disorders. The related, it's not OCD, but it's a cousin. But it would be, type of mental illness. Axis 1 is, if that's your question, Axis 1, under body focused repetitive behaviors. Can you please share more about poetry therapy? How can we use poetry therapy to help us? Well, I love this question. No one has asked this question yet, surprisingly. So poetry therapy can be used in so many different ways. And poetry therapy doesn't necessarily mean just using poetry. So for example, journaling, right? Journaling, quotes, songs, music, lyrics, all of those things count. Quotes, inspirational quotes. So we can use poetry therapy in so many different ways. We, of course, can use poems, right? Poems that are on topics like self-image, right? Like guilt, urges, so many different topics that you can find poetry on and then feel a little bit less alone and write about it, write your reactions. I'm not going to go into the whole detail of the poetry therapy process. Um, Actually, I did go into more detail. There is a webinar. You should be able to find it. I did do a webinar on poetry therapy and BFRB, so you can check that out. So yes, you can use poems. Journaling is a really popular, and I would say probably the most popular way you could use poetry therapy with BFRBs. Just journaling. You can use, of course, different prompts and also just journal, just release. Inspirational quotes, right? Putting up inspirational quotes on mirrors, by your computer, by your bed, in different areas that are triggering as reminders. So that's just a tiny bit of an example of how you can use poetry therapy. But check out that webinar. Yeah, and see if you have more questions that arise after that. I'm very detailed on the webinar. Where do you get a silicone skin slap bracelet? I think I got this on Amazon. Yeah, and it came in like a pack. Yeah, so I really like it. It's fun. This is a really good one for especially for kids and teens. The only thing is people might be jealous of them because they're so cool. But they are really fun, and it's a good strategy that you can just wear. So it's somewhat subtle. You can wear it as an adult, right? That's cool. That's fine. Stylish. So yeah, you can find it on Amazon. You can probably also find really maybe this and other really good fidgets on the Therapy Shop. That's another really good website. So those are, there are others, but I would say those are like the top two. Having relations scare me because of all the marks and wounds. How do I tell my current boyfriend about my situation? Does this relate to nail biting too? So yes, it relates to nail biting. Nail biting is also a BFRB, probably the most common one. A lot of people engage in nail biting and don't realize that it's a BFRB, but it is. It's within the same category. So only tell your boyfriend if you want to. If you feel comfortable, he will most likely understand or not care. And I don't mean not care as in not care about you. I mean not care in the way that he cares so much about you that skin picking and having marks is so insignificant. Oh, oh. Hold on, we got a visitor. One moment, please. Okay, sorry about that. That was a little visitor from a 1-year-old. So, yes, to get back to your question, he's most likely not going to care about the marks. He's going to care much more about you. So if it's something that you want to tell him, tell him, talk to him about it. He cares more about other parts of your body, honestly, much more than marks. So it's not going to be a big deal. But do it what feels right for you. Yeah, I would say that. When you do talk to him, if you do, most likely you're going to feel like such a relief, and you're going to feel like you don't have to hide it. Okay. The more we talk about it, the more we reduce shame. So I do recommend, in general, talking about it when you can, when you feel comfortable. Okay. I am 43, have been struggling as long as I can remember. My boyfriend is struggling with my image and keeps saying things like she likes to pick. It is really upsetting and I don't know how to handle it. Oh, so he's saying she likes to pick like when like talking to other people, like in social situations. Um, that's not cool. I mean, have a conversation with him about it. Let him know that, that's something that is private and you don't want him kind of joking about it and kind of talking to other people and saying things like that, because it's upsetting. And actually, when he says stuff like that, it's going to make you more self-conscious, right? And it's going to make you feel more guilty. And then when you have those negative feelings, you're going to wind up picking even more. So he doesn't understand that. So this is an opportunity to educate him. Tell him a little bit about what skin picking disorder is. Maybe giving him some of that background information will help him to see that it's not something that he should be making fun of or pointing out. So if you're having that conversation with him and he continues, I mean, you can ask him, why we had this conversation. Why do you keep continuing to kind of poke fun at me and say things like that? Like, it's really hurtful. So I would be curious to know how he responds, actually. Yeah, I almost want you to like update me, like what happens. Which you can. You can always email us at what is it? Support@skinpick.com, or me. You can email me directly, Laura@helpingminds.com. So yeah, I'm curious to know what that follow-up is. That is upsetting. Yeah, I'm sorry that's happening. I feel like I have reached the point where I have accepted that I pick my skin and no longer get upset by it. Once I stop a skin picking session, I just let it go and I know it is going to happen again, kind of losing hope. How do you try to stop yourself right before you pick, even after you have tried to control your triggers and environment? So I like to think about it in terms of managing. So not controlling triggers and controlling the environment, but managing triggers and managing the environment. So just changing that wording a little bit might actually make a bigger difference than you think. And you're right that working on using your strategies before you start picking, before the urge arises, that's key. So, does that answer your question? How do you try to stop yourself right before you pick? Yeah. So, kind of go through a little checklist in your head. Like, what am I thinking? What am I feeling? Right? What are the sensations that I'm noticing right now? So a little bit of a mindfulness exercise, to kind of check in with yourself and see what you need. I'm noticing I'm starting to have an urge. Am I hot? Am I cold? Am I thirsty? Am I hungry? Am I tired? Do I have to go to the bathroom? So kind of go through those basic needs first. And if those basic needs are filled and you're feeling okay, then go to the more in-depth ones, right? What are my thoughts right now? Do I need to rephrase anything? Do I need to pick up a fidget? Am I feeling kind of tingly? Do I need to put a barrier on? How am I feeling? Do I need to do some breathing? Do I need to walk around, change my position, change my location? So I would suggest trying some of those things and just seeing if that helps, if that makes a difference. Okay. Hopefully some of those suggestions will help you. Correct. Someone's asking about, am I meant to not see other participants in this live? That's correct. No one can see each other. Everyone can only see me. This way, this keeps your confidentiality, your privacy. I don't think that you can even see other people's questions. I'm not positive about that, but I don't think that you can see each other's questions. So we do that so it's as confidential as possible. That's another reason why I'm not calling on participants, because I think that if I call on you, then your video will pop up. So we're not going to do that. Is skin picking connected to misophonia when one is highly sensitive to various bodily sounds? Example, chewing food, yawning, breathing, causing irritability, anxiety, etc. That's a really good question, and I think that more research needs to be done on this. Um, I don't I don't know of any research done on this off the top of my head, but I will say that people with BFRBs are indeed um, do indeed have higher sensitivity to other things like sounds, textures, things like that. And I always tell people it's kind of like you have spidey senses, right? You're so in tune with these details of the body. So yes, a lot of people with BFRBs are also very sensitive to sounds and to touch, for example. I don't know specifically about this connection. Um, Certainly more research needs to be done. I can look into it, see if there has been any research. Um, but yes, a lot of people with skin picking also are very sensitive um, to, like I said, to, and what you're saying, to bodily sounds. Um, so I hope that answers your question. If not, ask a follow-up, or we can email us again at support@skinpick.com. How can I start talking to my family about my dermatillomania when mental health isn't really discussed in our household? Yeah, it can be tough, but very doable. Your family is there to support you. They care about you and they want what's best for you. You can, I mean, you can, if you're uncomfortable kind of talking about it in terms of mental health, you can kind of downgrade it a little bit, just to kind of start the conversation rolling, but educate them, right? Send them to skinpick.com, right? Send them to webinars, to blogs. Show them different articles. So educating them about what it is, and letting them know how it affects you. You also don't have to tell your family, um, but I mean, if you want to, if you feel comfortable, it is really nice to have that extra support. Um, and your family, again, just wants what's best for you. So if they hear that there's something that you're struggling with and that you're working on, they want to know what they can do to help. Okay, so I do encourage it. Hope that answers that question. Yeah, this is a good one too. Can using moisturizers and lotions help keep the skin picking at bay? Absolutely. Again, different strategies are going to work differently for everyone. Um, but using moisturizers is a nice way. If you have an urge, put some lotion on. Oh, here there's another urge, put some lotion on. It keeps kind of the area a little bit softer, smoother, slimier, depending on what kinds of lotions you're using. And that makes it a little bit harder to pick. Um, Not only does it make it a little bit harder to pick if you keep putting moisturizers on, but it also feels good. So it's a really good example of self-care. Engaging in self-care is a really good and important strategy. So I do recommend it. If you're using a lot of moisturizers, do make sure it's like paraben free, maybe organic, something that's not going to irritate your skin further. Um, you can experiment with fragrance free versus fragrance. Some people like the fragrance because it adds another level of relaxation. Some people don't like the fragrance and it's more likely to irritate your skin. I found it hard to find the motivation to get better and or the self-efficacy to believe that I can get better. Any advice on how to push through? even when you hit failure after failure. Yeah, motivation is a tough one, and motivation does come and go. And it's not hitting failure after failure. Um, and I'm smiling because this is an opportunity to rephrase, right? How can you rephrase that? Um, when you think of slips as a failure, and you're still picking, that's a failure. It's going to make you feel worse. Um, and when you feel that way, you're not going to stop picking. You're not going to manage it because you're just going to feel bad about it. Failure is such a like defining word. It's very harsh, right? The failure. But if you can rephrase it to, I keep hitting roadblocks, right? See if that makes a difference. When you rephrase how you're thinking, you might notice that your motivation improves. So, oh, I keep hitting roadblocks. Oh, um, I'm noticing that I'm really getting frustrated with this, right? Or this is causing me to feel like a failure. You are not a failure. This is part of the journey, part of the process. Slips is expected. Um, so it does not mean that you're a failure. It does not mean that it's hopeless. It means that you're learning. Okay. It means whatever you did in that moment didn't work that time. So, okay, next time I'm going to try something else. Okay. Um, so hang in there, hang in there. Um, and if you're having a low motivation day, that's okay. Tomorrow's another day. Um, Motivation comes and goes. So don't beat yourself up about it when it's low. Have extra self-compassion. Do something that's going to make you feel good. Self-care, like I mentioned earlier. Do something to treat yourself to something that will help with motivation. I love these questions that are coming in. So many. Um, is there evidence of the efficacy of in-person versus telecounseling for skin picking? Good question. So, research has shown actually, when you look at telehealth versus in person, that there is no difference. Interesting enough. Um, so both work. If you're in person or a video session, they both work equally the same. Um, the only thing that I would add to a telehealth for skin picking um, is that you can't see my hands right now, right? So when you're in telehealth, you very easily could be picking at the same time, um, and your therapist is not going to know unless you tell them. So that's the main difference. If you're picking in the office, your therapist will see that, and then they might offer you some strategies. They might hand you a fidget. What's going on right now? Do you want to talk about it? If you're on video, they're not going to see that you're picking, and they're not going to know to help you unless you say something. So I would say that's the biggest difference, that you could sneak it uh, when you're in video sessions. Um, but other than that, the actual therapy is the same. Okay. Uh, does the area of focus on the body impact the amount of time it takes to see improvement with treatment? Does the area of focus on the body impact the amount of time it takes to see improvement with treatment? I'm not sure I fully understand this question, um, but as you gain awareness, treatment kind of becomes a little bit easier because you understand what your triggers are, what's going on, and you're better able to start to use strategies before those urges hit. Um, I don't think there is a specific amount of time for treatment for anyone, whether or not there is a lot of focus on the body, or in different parts, or a little focus. It all depends on the individual. Um, so I think it's just all dependent. Either way, it does take time. It's not like a simple quick fix, unfortunately. Is there a place where we can read the studies done by Dr. Grant? If you just Google him, Dr. Grant skin picking, you'll find his research articles. They're all over the place. So just Google them. Yeah. Um, I think there is still a research section on bfrb.org, so you might be able to find some articles there, by Dr. Grant, but I think that the easiest place is just to Google him. Dr. Grant skin picking disorder, or Dr. Grant body focused repetitive behaviors, and see what kind of research is out there by him. So does ADHD play a part in skin picking? And I'm seeing another follow-up question also. How would being on stimulant, to manage ADHD affect skin picking? So, so ADHD and skin picking are different. They're two separate disorders. But that said, ADHD is one of the most common co-occurring disorders, right? Because it has to do with over and under stimulation, right? And same with skin picking. So there's a lot of overlap. ADHD and skin picking are treated differently. So that is why they are different. But yes, if you also have ADHD, it does play a part in your skin picking. It does impact it. So it is important to treat both, if you also have ADHD. That said, I'll do the follow-up. I see there's a follow-up question about how would being on a stimulant to manage ADHD affect skin picking? So medication for ADHD can be helpful for ADHD. Some medications for ADHD increases skin picking. So something to be mindful about, something to talk to your doctor about. So if you are on ADHD medication and you are noticing that you are picking more, that particular ADHD medication then is not the right one for you. There are many options. Not all ADHD medication is going to increase your skin picking, but some do. And again, it's all individualized. So if you do notice that, talk to your doctor about it. Okay. I'm just gonna skim. Oh, we got a lot more questions to go through. Okay. Has there been any studies about the effectiveness of DBT as a long treatment for excoriation disorder? I'm doing some research on this and haven't been able to find anything. So, treatment is a combination of things. So just effectiveness of DBT alone is not going to do anything. You want to combine it with other things. So combine DBT with CBT, combine it with habit reversal training, combine it with a comprehensive behavioral model, combine it with acceptance and commitment therapy, right? Combine it with just the person-centered approach. So effectiveness of DBT alone is not effective. Okay. You want to use it in combination with other things in order for treatment to be effective. Okay. Yeah, so dermatillomania makes me lose track of time, making me struggle with time management. Yep. How can I take steps to address this? Yeah. So that's common. right? Because you kind of, when you're in the middle of like a picking episode, it's kind of like a trance. So you lose track of time. And time winds up going by really quickly. So something, one strategy that can help is actually to set timers. So for example, if you pick a lot while you're at the computer, maybe set a timer for however long, whatever makes sense to you, every 45 minutes, every hour. So when the timer goes off, you can take a break. Or when the timer goes off, if you happen to be picking during that time, it will remind you, oh my goodness, let me like get back to work, right? Um, Same thing with watching TV. That's another common place. Um, a helpful way, if you don't want to use a timer to help with the time management, you can also kind of time things like based on TV shows. So I'm going to watch this TV show. When the TV show's over, I'm going to get up. So if you are picking while watching the TV show, once the TV show's over, you're done. You get up, right? It's timed. Um, Bathroom music. I'm going to listen to music. I'm going to listen to X number of songs, and I'm going to get out of the bathroom, right? Or if I'm picking, I'm going to pick for one song. When the song ends, I'm gonna stop. I'm going to end. So using things around you, timers, lengths of TV shows, and music can kind of help with that time management. Also, phone notifications. You can kind of set up phone notifications to go off randomly, or phone alerts as a reminder to kind of check in with yourself. So when that goes off, you might be in the middle of picking and it might go off and you're like, oh, let me check in with myself, right? So that could be a helpful way. Hope some of those things help. Give it a try. There are always other options, tons of options, but start off with those. Do you know if microneedling can help with healing scars from skin picking? I don't know. And I think every person and every skin is different. So you would have to, people have certainly done it and have tried it. You would have to consult with the dermatologist about it, because I don't know too much about this. And the dermatologist is the expert. And again, I wouldn't try any kind of treatments like this until you've given your skin enough time to heal. So kind of see where you're at first, talk to your dermatologist and see what makes the most sense for you. Um, Most likely a dermatologist is going to suggest starting off with something lower level first, like creams or silicone patches, things like that. So start off with other things first and then kind of work your way in that direction, if that makes the most sense for you. Sorry, I don't know too much more about microneedling. Oh yeah, it's feeling like there's something embedded under your skin that you feel you must remove common. Yeah. Yeah, I mean, people feel all sorts of different things, but feeling like there's something under there, um, is common. It feels like a little tingling, or again, we talked about being highly sensitive. So your awareness is kind of like in tuned to parts of your body. Um, so you might be uncomfortable with something. Um, I would suggest though to consult with a doctor first. So it is possible, right? There is some kind of underlying factor that feels like there's something under your skin. Um, So always rule out medical first. Make sure that there actually is not something under your skin. Um, Double check that. Most likely there is not, but still double check. But yeah, that like kind of tingling, or sometimes like if you're picking an area, it might kind of heal a little bit funny. So it might feel like there's something there, or like an ingrown hair. So it might be a little bit uncomfortable. And again, you're going to be more aware of that. So it's going to bother you more. But yes, common. Uh, oh yeah. I'm curious if you know anything about people who pick their head and then eat it, and is that part of the disorder or is that a separate issue? Yeah, that happens. That can happen. I would want to know, are you eating the skin or are you eating the hair? Because there is an important difference. So if you're picking at the scalp and hair is coming out and you're eating the hair, that's related to trichophagia, and can cause blockages. So it is related. It's related to BFRBs, but can be a little bit more risky and a little bit more dangerous. Um, but if you're eating the skin, that's not going to cause, to my knowledge, blockages. So that's from the health perspective, that's not as risky as eating hair. But yeah, it happens. People do it. Yes, it's part of the disorder. I would say it's a little bit less common than just picking. Adding that additional aspect of eating um, is the less common part, but it's there. People do it. Yes, it's related. Is increased bleeding with NAC? Um, I'm not, do you mean like if you're taking NAC and you're picking, are you more likely to bleed more? I haven't heard of any reactions or side effects of any increased bleeding. NAC is one of the least side effect things you can take, as far as I'm aware. Um, so no, it's just replenishing your amino acids. It's not going to affect bleeding rates. No, I do not. Should I be able to see other people's questions? No, I don't think that you can. I think only I can see them. What are the best types of fidget toys you would recommend for dermatillomania and trichotillomania? Well, I can go on and on and on about fidgets. And I did a webinar on fidgets, and I was very specific. It's a whole long presentation with different kinds of fidgets and different kinds of categories. So definitely check that out, because there are so many different kinds of fidgets. So I can't even answer this question because um, it would be like an hour and a half to answer the question, right? There are a lot of different fidgets, and there is no best type. It's the best type for for you and for whatever situation your urges are. So one fidget might work in one situation, but not another. Or one fidget might work one day and not another. So it's really important to have a lot, and to kind of keep switching them up. As I said, right now, this is the one that I happen to have right here. This is a good one, especially for public use, but there are a lot. So check out that webinar and you should be able to find it under the past webinars. Someone's just joining in late. What are the supplements you're speaking for? I think this question is referring to NAC, or N-acetylcysteine, which is an amino acid supplement, which is right now the most researched, medication for BFRBs and the most promising. Ah, could you give a description of what focused picking and automatic picking looks like? Are there first line treatments or treatments for each? So yeah, good question. So automatic picking is when you're not aware, right? You're just sitting, watching TV, picking, and maybe you realize it after the fact. Oh man, I just watched a whole movie and you see a pile of skin scattered, right? And you didn't even know it. You didn't even realize you were picking. So that's automatic. Automatic meaning not aware. Focused picking means that you are aware. So you are intentionally picking. You have that urge. You think about it. That urge is too strong. I'm going to pick. I'm going to look in the mirror and I'm going to find that spot. I'm going to pick while looking in the mirror. So that's focused picking. Um, so yes, treatment actually is a little bit different, because if you're automatic picking, the goal is to be more focused, to increase your awareness. So if you are not aware of your picking, treatment begins with tracking, different kinds of tracking methods so that you can increase your awareness. As you become more aware, as your picking becomes more focused, then you can um, think about what strategies you want to do in what situations. Some things to help with awareness is something called, besides tracking, if tracking is not working for you or you need something in addition to that, something called like the Keen Habit Aware bracelet. That's a really good bracelet piece of technology, kind of buzzes when you're in certain positions. So that is helpful if you are not aware, if you're an automatic picker. That helps to increase awareness. Okay. Uh, Not a question, but for a woman having fake nails helped so much. The nails are sensitive and beginning of 3 days to even pick due to filling and also bandages over the same place, picking spots helps stop blocking the spot. Absolutely. So for some people, having fake nails or going to get your nails done frequently is a really good barrier. It's also really nice self-care. Um, and bandages are a really good barrier and block as well for picking. Yeah. I do not have the ability to share links. Someone's asking for links to some of the previous webinars, but if you go onto the website and just search for webinars, past webinars, you should be able to find it. You should be able to scroll through them all. If you have trouble finding it, email us. Email us at support@skinpick.com and we'll find it for you and we'll send you the link that way. Okay. Have some repeat questions here. A follow up on the slap bracelet that I showed. Do you use a slap bracelet as a distraction to scratching? You can. You certainly can. I like how it kind of clicks a little bit. You can certainly use it to kind of massage. There are a lot of different fidgets that you can use to massage um, or scratch without actually you touching, but this feels nice. You can certainly use it in that way. You can use this in whichever way makes the most sense for you. There is no right or wrong way. Uh, oh, so this is similar to another question. How can I talk about my picking with loved ones, especially my parents who used to punish me for picking? Should I even try? You can try if you want to. I'm sorry that your parents punished you. That, you know, they didn't understand. They want the best for you. A lot of times parents panic and they get really nervous about it. So they think that punishing is going to be helpful. Um, when actually it's the opposite, right? It makes it worse. A really helpful strategy is the reward system instead, right? So parents can use the reward system with their kids, rewarding them for using strategies. So not punishing for picking, reward for strategies. If you want to try similar to the last one, start with, if you do want to talk to them about it, start with the education aspect of it. Let them know what it is. Send them links, send them to articles, resources, and let them know that punishing was hurtful, did not help, and instead here are some ways moving forward. Here's what they can do instead, right? um, and if you're older and the reward system doesn't work for you anymore, um, your parents can still do other things for you, right? How are you? Right? Can I get you anything? Right? Things like that. Do you want to hang out? You want to do an activity? You want to go on a walk? So doing other things, not punishing. So what are the best topical solutions to lubricate, heal wounds after you've picked? I don't know. I would say if it's to heal and for any kind of open wounds, I mean, things like bacitracin, neosporin. Um, but you would have to consult, and bandages, but you would have to really consult with the dermatologist about other options and other options that are going to work for you. Um, yeah, so you would have to talk to a dermatologist. Over the counter things, like I said, bacitracin, neosporin, and band-aids. uh, Previous therapists have reduced my skin picking to anxiety and self-harm due to lack of awareness. I know there is a link to anxiety, but is it possible for dermatillomania to have a self-harm component as well? So, dermatillomania is not self-harm. Um, Self-harm is when you're doing something with the intention to hurt yourself, right? It's the intention for kind of damage, I guess. But it's with that intention. Um, Skin picking does not have that intention. The harm is kind of an accident. It's kind of an accidental consequence. Picking is done to self-regulate. So it's a little bit different than self-harm. I think that's a really common misconception, that skin picking is considered self-harm. It's not. It's soothing. It's relaxing. It's not for the intention of hurting yourself. It's for the intention of soothing yourself. Self-harm is the intention of harming yourself. Um, Harming yourself for the purpose of soothing. So intention of harming self, maybe for the purpose of soothing, but skin picking is the intention of soothing with the accidental consequence, maybe of harming yourself. Um, Subtle difference, but they're different. It happens to me even when I sleep. I'll scratch and bleed. I am trying to be more mindful, but don't know how to help it while I'm sleeping. Yeah. Um, you can't really be mindful if you're sleeping, right? Because you're asleep. So if you have automatic picking while you are sleeping, barriers are your best friend here. So depending on where you're picking, I mean, gloves is the most helpful barrier, I'd say, for nighttime, because then if you go to pick while you're sleeping, it's going to be blocked, no matter where on your body you pick. You might want to have a couple of barriers in place. So maybe some like thin cotton gloves, but also like wear longer pajamas, maybe also wear socks, because it's possible that you might take off your barriers while you're sleeping and not realize that you're taking them off. So that's why it's helpful to have a couple of different barriers in place, in case one comes off. Um, it's common, but try some barriers and see if that helps. You can also think about, besides barriers, actually think about your bedtime routine, right? So what are some things you can do before going to sleep that are going to help relax you? Okay. So just some things to think about. Are BFRBs linked to autism? No, they are not. They are different. Someone can have a BFRB and also have autism. It is another common co-occurring disorder, but it is not necessarily linked to autism. So they are two separate things. One can have one without the other. Yeah, so I hope that answered that question. Just skimming through because I'm noticing the time. Um, oh, someone, okay, so someone is saying they can see the questions. Interesting. Um, Here's another autism question. Is my autism, since it helps me regulate my emotions, is it skin picking a coping regulation tool? Yeah, so with autism, there's such thing as stimming. So stimming is different from skin picking. Um, so you'd have to really talk to your doctor to see if your picking is related to stimming and related to autism, or is it related to skin picking disorder, or is it related to both? So it's tough to tell just by reading your question. So in both situations, skin picking, yes, and for autism, it's kind of a way of coping and self-regulating. Yeah, so it's hard to tell unless you're evaluated by your therapist, by your doctor. Uh, a therapist explained to me to talk to myself like I would my best friend if they were struggling. Yup. That helped me change my self-talk. Every time I fall into the self-bashing, talking, she suggested I pull up pictures of my friend and talk to her, helping me rephrase as you suggested. Yup, that's a really good strategy. I agree. Um, we are so hard on ourselves. So instead, when you're being hard on yourself, think about, well, if my friend was right here, if my friend was picking, what would I tell my friend? Let me tell that to my friend. So yes, that's a really helpful strategy. Okay. Yep. Can a person be a skin picker and a nose picker? Are they the same? Yep, I would say it's the same, especially if you're picking or it's related. Are you picking like your nose gook or are you picking the skin on your nose? Um, so that would be a follow-up question, right? Nose picker meaning gook or skin. Um, and if you're picking the gook, is it interfering with daily life, right? Is it causing embarrassment? Is it bleeding? So there are questions to ask to see if nose picking would be in the category of skin picking if it's a disorder. I don't, so I would say it just kind of depends. Um, but if you're a skin picker and you're also picking your nose, and often it's related, right? It's kind of that same similar urge, similar feeling. Okay. Yeah, when I pick my skin, it makes a mess. It's embarrassing because there are visible piles of skin, yep, on my seat, desk, on the floor. How can I manage the mess associated with my picking? I mean, not much you can do besides not picking. Um, but managing the mess is just clean it up after, right? Throw it away, put it in the trash, take a tissue or something. Uh, if you really want to, I mean, you can always put um, kind of like a cloth down or something to kind of gather it. And then pour it in like a spill cloth kind of thing to help gather it and put it in the trash can. But other than that, just a broom, just sweep it up. I don't think there's anything in particular you really have to do um, for the after effects of the mess. I'm seeing some repeat questions. I'll just go over them really briefly. What is the recommended dose of NAC? Right now it's 1,200 milligrams. Broken up though, so 600 and 600. That's a recommended starting dose. But again, talk to your doctor. Um, what are side effects of overdosing on NAC? I don't think that you can. I mean, maybe you would feel like get an upset stomach. So I don't know. It's just a supplement. It's not a medication. It's an amino acid. So, basically it would be like really expensive pee. You just pee it out. So, um, so as far as I know, there are no great side effects. Um, but that said, don't go taking a huge amount of NAC because you're panicking because, oh my God, I'm picking so much, I gotta take all this NAC. It doesn't work like that. So take it with the guidance of your doctor, take it slow, see how you feel. I'm a nursing student and I'm worried about how my picking will interfere with my job performance. Any tips for dealing with skin picking as a healthcare worker? Um, yeah, that's a good question. I think it's important to be mindful of when you're picking. So how do you feel it's interfering with your job performance? It might not, right? Maybe you might get stuck in the bathroom a little bit, um, or while you're working on the computer, or filling in things in between patients. So I think the first step in how to manage skin picking as a healthcare worker is just to be aware. So be aware of what are the situations, when are you picking during the day at work? And once you know when during the day at work you're more likely to pick, then you can kind of think about what strategies. So maybe there's if you're a nursing student, there's very little you can take in with you. Maybe like a lot of nursing students have like fun buttons, pins, right? So you can kind of have like a fun pin as a reminder or some kind of fidget on your clothing. Um, you're wearing gloves a lot, so maybe keep gloves on longer than you normally would. Or you switch out gloves to a fresh pair, but keeping gloves on frequently. So things like that. So first, be aware of what are the situations you're picking in while you're at work, and then you can take it from there. I'm skimming through the questions because there's still a lot left. We do have to start to wrap it up. Can a person be just a skin picker for only one part of the body? Yep. So like toes. Yeah. So yeah, you can just, if you're a picker, some people just pick toes, some people just pick cuticles. Um, so yeah, it sometimes when you're trying to manage one area where you have urges, sometimes it can travel and can pop up in another area. So just something to be mindful of. If you're trying to manage like toe picking, for example, be mindful if the urges start popping up like on your heel or on your fingers, right? Um, but yes, absolutely, it can only be one part of the body or it can be at multiple parts of the body. Um, why would a person not feel the pain to skin that it causes? So for someone who has a skin picking disorder, it's very soothing. It is not painful. It is maybe painful after the fact when it starts to bleed, but the actual act of picking doesn't hurt, right? It's very relaxing, it's soothing, it's like a trance, it's meditative. For someone who is not a skin picker, it would hurt them, right? They don't have the disorder, so for them, it would hurt. But for someone who has a skin picking disorder, it does not hurt. I'm not sure if that answered your question. I hope it did. You kind of get so used to picking, also, you become a little bit desensitized to it. Oh, I have not heard of this. My primary doctor prescribed Musipron, and it works beautifully. That's great. Again, different things work for everyone. So it's really great when you found something that works for you. Exciting. I'll have to look that one up. So how much is too much NAC? So again, the starting dose is as I mentioned earlier, the starting dose is 1,200 milligrams, and it goes up to 2,400. 1,200 milligrams is the starting point, goes up to 2,400 milligrams. Again, do not take NAC without consulting with your doctor. Make sure you're being managed by your doctor. So don't just go up to the highest dose. There's some research that shows that you can go a little bit higher. But again, there's so much that's still unknown. So I would, if you are taking NAC and talking under the guidance of a doctor, stick to the 1,200 to 2,400 milligram dose. Okay. So what are some mental tools or ideas to use before, during, and after picking, like coping with the urges and the non-self disappointment in oneself? So what are some of the tools, ideas before? So again, when you're starting, before picking, when you notice the urge, ask yourself, oh, I'm noticing an urge. Why? What's happening? What am I thinking? What am I feeling? What does my body need right now? So that's a helpful strategy for before, because then if you discover your body needs something, then you can fulfill it. Oh, I'm really thirsty. I'm going to go get a drink of water. Oh, now I feel better. The urge went away. During picking, again, being mindful of what you're telling yourself. What are those thoughts? How are you feeling? Doing some rephrasing. See if you can pick up a strategy. See if you can pick up a fidget. It's really hard to do in the middle while you're picking. It's easier to use a strategy before you start picking. Yeah, and then after picking, a lot of compassion, self-compassion, self-care, a lot of rephrasing, have understanding, think about what just happened, what can I do differently next time? Go easy on yourself. Is there a reason why someone would just pick at the toes to the point of raw skin and bleeding? It has to hurt. So why not feeling the pain until afterwards? And then habit or obsessive? How to determine why? Boredom sometimes doesn't realize it's being done. Yeah, so this is a disorder. That's why it's a disorder. It's not a habit. It's a disorder. It is it is for self-soothing, so it does not hurt. Often it does hurt kind of after, right, when it does start to bleed, or if it becomes raw, then you might have to put extra band-aids, extra padding, if it's on the toes or the feet. And yeah, it often happens when you're understimulated or overstimulated. So boredom is a really good example of being understimulated. Stressed and overwhelmed is an example of being overstimulated. So many different things can trigger urges. I would suggest for this person to do some tracking. It sounds like there's still a lot of questions. So start off with tracking to learn what your patterns are. So once you kind of learn your patterns and gain a little bit more awareness of what's going on, then you can start thinking about different kinds of strategies. Any suggestions on what to say to interrupt my teenager when I know they're picking and that won't come across as annoying or frustrating them? Yeah, that's a really good question. Um, yeah, because if you point out, right, stop that, or I see that you're picking, they're gonna be embarrassed. And what's gonna happen is they're gonna still pick, but they're gonna hide it. They're gonna do it in their room. They're gonna do it when you can't see them. And it's gonna be more. Because they're going to, right, get annoyed and get embarrassed. So instead, if you see your teenager picking, um, you can kind of interrupt them by just having a conversation with them, right? So just kind of distract them. Oh, hey, how was your day? Oh, I didn't get to ask you how your day was. How's so and so? Oh, do you mind helping me with the dishes? Right. Can you help me with this errand? Oh, I'm thinking about going on a walk. Would you like to come with me? Something like that. Can I get you a drink of water? Would you like a snack? So things kind of like that. So it's kind of gets them a little bit out of the trance. I would suggest doing that. You can take it a step further depending on what they want is you can hand them a fidget. But I only suggest handing them a fidget if you have a conversation with them in advance, asking them, what can I do? What can I do if I see you picking? What would you like me to do? So ask them. I think that's a really important thing to do, especially for a teenager, because they'll tell you, um, don't say anything, right? Or, oh, yeah, you can hand me something, sure. Right. But ask them what they want you to do. Okay. That's a nice way to help them feel more empowered as well. Okay. I think I'm going to wrap it up here. I'm seeing there's still a couple of questions left, but they're about strategies. And there are so many different kinds of strategies. Give an example. Strategies. What's this one? Uh, I also, okay. So in terms of strategies, I will answer that question since there are two of them here. Um, so there are a lot of different strategies. So when thinking about strategies, think about, I like to think about the acronym SCAMP. So sensory, cognitive, affect, motor, and place. So you can have strategies in all of those different categories. So sensory strategies are like fidgets, right? Different kind of fidgets. That would be a sensory strategy. Cognitive strategy is what we talked about, rephrasing, right? Cognitive strategy. Affective strategy, how you're feeling. That would be things like breathing, relaxation, journaling, right? That would maybe help and be a strategy for affective. Um, Motor strategies, um, thinking about barriers to block yourself, block your movement. Okay, that would be a motor strategy. And place strategy, that would be working on your environment. So changing your location, sitting in a different spot on the couch, dimming the lights, covering the mirrors, um, working on how you can manage the place. So that's just a very, very brief overview of different kind of categories of strategies. And this is all in addition to just talking, right? Talking it out, asking yourself what's going on, figuring it out. Yeah, okay. Someone is responding, follow-up failure. In substance abuse recovery, a relapse is going back into the addiction, continuing and giving up until next crisis. A prolapse is recognition that there's been a mistake and something overlooked, a mistake in the recovery plan and a willingness to review the recovery plans and actions to take to learn how to better manage the trigger. Yeah. So I kind of relate a little bit more than to that definition of prolapse. I don't really like the word relapse. I call them slips, right? Because it happens. It's part of recovery. It doesn't mean that you're starting all over again. It doesn't mean you're going backwards. It doesn't mean you're gonna give up. It means that something happened, right? It was a slip. It was a really hard situation. Um, so you had a slip, and think about self-care. What can I do differently next time? How can I prepare for next time? How can I use all of my knowledge and all of my skills? So whenever you have a slip, you don't lose all of that knowledge and skills. It's still there. Slips are frustrating. There's also a webinar on that as well, on slips and feelings. So that could be something to check out as well. Okay. I only pick existing scabs. I don't create new ones, and I pick less when colder weather results in fewer wounds from bug bites. Yep, and I'm wearing long sleeves. Is that still skin picking? Yes, it is still skin picking, but there are different levels of skin picking. So perhaps you identify with like a mild case of skin picking disorder, right? If you're only picking at scabs, and you're able to kind of manage it. You're picking less when the weather's cold. You're covering up from bug bites. So yes, it's still skin picking. Um, but again, if you're managing it and you feel comfortable and you feel confident, it's not interfering with your life, then you're all good. It's only a problem if it's bothering you and if it's interfering or causing infections, right? So if it's not doing those things, then consider yourself lucky that you are managing it effectively, and keep up the good work. Yeah, why is skin picking so compulsive? I feel obsessed with it. As I can tell myself to stop, but my fingers are sneaky. They are so sneaky. And once they feel the dryness, I can't stop until the dryness is removed. Yeah, so frustrating. It is frustrating. And that's why it's kind of under other compulsive and related disorders. It's similar. It's different, but it's also similar. It feels so good, right? It's so soothing, and that's why it's so hard to stop and interrupt it. And it is frustrating. You're right. This is a common experience and a common feeling, and those fingers can be super sneaky. I agree. Okay, I'm getting some thank yous. I see one more, which is a follow-up. I also use mu mupirocin regularly as my dermatologist. As per my dermatologist, it is a prescription ointment, and treats skin infections. Great. And it works excellent for healing lesions and preventing treating infection. Great. Yeah, so as I mentioned before, any kind of treatment or prevention for wound care and for scars, make sure you're connected with the dermatologist, and you are, so that is great. Perfect. Um, oh, someone said they have not heard of skinpick.com, so I'm glad that you've heard of us now. Yeah, check out the website. There's a lot of information, a lot of blogs, articles, webinars. You can sign up for the newsletter. So there's lots to learn. So yeah, you're welcome. Stay connected. If other questions come up later, again, feel free to email us, support@skinpick.com. We will either answer you right then and there, or you can always save your questions for the next question and answer session, because we will be doing more of them. We do them pretty regularly. So thank you. I'm seeing a bunch of thank yous coming in. Thank you so much. Very good. And maybe you'll join next time. Okay. Thank you, everyone. Thanks for joining. Gonna stop the recording.